Thanks to the Independent and to Bull City Rising, and welcome to all of you. After living most of my life in the Triangle, I understand what makes our region thrive. Advanced research, educational opportunities that fuel the economy, small businesses that find a supportive environment, and a high quality of life for our families. I've worked hard to strengthen these very things, passing measures to make college more affordable, to recruit high-quality teachers for our schools, fighting for investments in advanced research, including alternative energy, supporting business growth through tax incentives and better access to credit. And I've helped with local road improvements, high-speed rail, and other infrastructure investments critical to our economy. On the question of fighting for our priorities, there is a stark contrast between me and my opponent. He speaks in generalizations about the virtues of free enterprise and how government has overstepped his interpretation of the Constitution. But listen closely tonight, because what lies behind those words is an extreme right-wing ideology that would limit opportunity for the middle class and set North Carolina and our country back for decades. For example, my opponent wants to eliminate the Department of Education. And she says, I can't think of one good thing that comes out of it. Tell that to a parent of a kid with special education needs, or to a student who wouldn't be attending college without a Pell Grant. He wants to end all federal research support, pulling the rug out from our universities and business. It's in the research triangle of all places. He wants to replace the progressive income tax with a 30% national sales tax, raising taxes on the middle class and cutting them for the wealthy. To say nothing of pulling the U.S. out of the UN, militarizing the southwest border, and refusing to take a stand on don't ask, don't tell. On these issues and others that are important to the people of this district, I've worked to faithfully represent our values and our aspirations, and I pledge to continue to do so if I'm re-elected as your representative.
Thank you all for attending here this evening. Thank you also to the Independent and Bull City Rising. My name is B.J. Lawson, and I am running for Congress because we need to bring some new ideas to Washington. I am, like you, deeply concerned about the direction our country is heading. And I'm most concerned about three things: restoring a prosperous economy where we are free to engage in honest capitalism, to do well by doing good, and to grow our local economy by creating our own jobs and our own businesses. I'm also, as a physician, desperately concerned about health care. I understand that health care has been taken from doctors and patients. And this didn't just happen, it's been happening for the past 50 years. But how can we empower patients and doctors to once again take ownership of our healthcare system? And finally, I'm interested and absolutely committed to restoring trust in government. We have legislative malpractice in Washington, where Congress is routinely passing bills that number in the thousands of pages without even having read them first. Now, these problems just didn't happen overnight. They didn't happen over the last 2 years, or the past 4 years. These have been generations in the making, but they've certainly accelerated over the past 20 years. My opponent, Mr. Price, has been in office for the past 20 years, and he is a good man who does care deeply about our community. But at the end of the day, we have to look at how he votes. His voting record is very clear. He votes with Nancy Pelosi more than any other congressman. That's a reflection of the fact that he has been trapped up in a toxic system of political patronage where, to get reelected, he relies on corporate PACs out of the district to the point where over half of his campaign contributions come from corporate lobbyists in D.C. That's not representing us. That's representing the interests of Washington insiders who have allowed and encouraged our federal government to grow without bounds. At the end of the day, I'm just a regular guy asking basic questions about what our federal government is doing and how it should be behaving. I look forward to an active discussion tonight and look forward to earning your vote. Thank you very much.
America has, for over a decade, spent more per capita on healthcare intervention than any nation in the world, yet has miserable comparative health outcomes, longevity, and quality of life scores. What impact will this year's healthcare reform legislation have on this fundamental disparity, and what more, if anything, do we need to do as a nation to address gaps in coverage, availability, and outcomes?
The healthcare reform that was just passed will do exactly what has been done in the state of Massachusetts, which had similar reform. It will make healthcare more expensive and less available and lower quality. What we need to do is we need to recognize that to fix our healthcare system, we need to start by fixing primary care. And the way you fix primary care is you recognize that giving our entire healthcare system to a system of third-party payers that includes Medicare, Medicaid, and private insurance companies literally puts 40 to 60% extra costs running every single doctor's office in the country. When we can get primary care returned back to a cash pay system where patients pay for their service the way you pay for groceries at the grocery store, medicine isn't any more necessary than food, right? And when you think about how we fund food versus how we fund healthcare, it's clear that we're doing things incorrectly. But when we can begin to understand that true health insurance needs to be health insurance, not a subscription to see a doctor whenever you want to see one, but a way to manage risk and save for the unexpected catastrophic occurrences that are more expensive. At the end of the day, I tell people the American healthcare system works great unless you're a patient or a doctor. For everybody else, it works pretty well. And my commitment is to advance real healthcare reform where we fix primary care, we improve access, we improve quality, we reduce costs, and give healthcare back to the people who matter the most, the doctors and the patients.
Actually, I think my opponent's healthcare system would work well if you're a patient who can afford to pay cash on the barrelhead, can simply pay cash for healthcare. You understand what he's saying? And also, it'd work well for doctors who only want to treat such patients. For the rest of us, it wouldn't work very well at all. In fact, it represents a kind of gated community view of medicine. Those who can afford to pay cash would be just fine. The rest would be out of luck. And understand, he also thinks that any governmental role is unconstitutional, not just the new health care law. So he would abolish Medicare. He would put senior citizens on that kind of cash pay basis, just getting the best deal they could, and would eliminate Medicaid as well. In other words, it would leave untold millions of Americans without protection. Now, the Patient Protection Act, which I have supported, is not perfect. I would have liked to have had a public option to bring costs down further, for example. But it will say that if you have insurance at your workplace and you like that insurance, you could keep it. We're going to make sure there's no fine print of that insurance that imposes some kind of lifetime limit, so if you get sick, you really aren't covered. But you can keep that insurance at work. But for the rest, for the small businesses, for the uncovered individuals, there's going to be a marketplace, a competitive marketplace where you can shop among competitive plans at an affordable price. And for the first time in this country's history, we could look our fellow citizens in the eye and say, you will never, ever be denied access to health care. It can never be taken away.
Thank you, Congressman Price. Dr. Lawson, you have 30 seconds.
There was a lot of talk about insurance in his response, which indicates the problem that we're facing. I do not object to healthcare safety nets. As a civilized society, we need healthcare safety nets. But let's recognize that it's a whole lot cheaper to give folks who need a safety net a debit card or a way to pay at the point of care to see their primary care provider than to pretend like we can afford to be dumping all of this money into private insurance companies, Medicare, and Medicaid bureaucracies and what that does to physician office practices.